Hey, good morning, Dave. I recorded this yesterday, at least tried to, and I completed it and had found out that my phone had stopped about 4 minutes into it and I didn't have more space left on it. So I've gotten this to you sooner. I may post this on the Epic community too if you think it's valuable for others. So basically, this is in response to something you had posted on the Epic Peds site regarding a kiddo that you were having. I think it was a sensory kiddo who his care has been up and down, meaning better. I should say not his care has been up and down, but his response and what's going on in school has been up and down for the kiddo, meaning he's getting some good marks, but then lately his symptoms and his behaviors maybe regressed some. And in it, you mentioned the liberal use of Tylenol and antibiotics, and I sent you a message saying, hey, are you familiar with glutathione? And so I know we don't talk a ton about this in some of the Epic stuff, but I think we should, especially with the more challenging kiddos. So a lot of this information is from Dan Murphy, Mark Hyman, and quite a few others. And so this is going to be lengthy, and I will do my best to speed it up. And just to warn you, when I get excited, I tend to talk faster and mumble more and more. So here's my prep area. First thing we're going to talk about is the blood-brain barrier. We all know from chiro school, embryology, and all that fun stuff about the blood-brain barrier. And I believe Tony talks about this in some of the Epic Peds training. I know I've seen some other through the Diplomate course and ICPA. Blood-brain barrier is not fully developed, obviously during in utero environment. But what the research shows, excuse me, I got a frog in my throat, is that the blood-brain barrier really starts to develop at about 6 months of life. And through here, it says that we are not born with an intact and functional blood-brain barrier system. It is known that this protective barrier is incompletely formed in the newborn, and when it reaches a state of full maturity is unknown. And there's some evidence that it may not reach complete maturity until adolescence. This talks about during this growth of development, the nervous system is particularly vulnerable to the damaging effects of a multitude of excitotoxic compounds. And it also talks about the strength of the blood-brain barrier also varies with age. It is very poorly developed at birth, and it takes many years before it reaches maturity. And it says prior to the 1960s, the food industry was regularly adding MSG to baby foods. And what it showed was that there was a growing evidence of MSG toxicity on the brain prior to this period, and that MSG exposure provided significant risk of brain damage to those kids. MSG is an excitotoxin, according to Russell Blaylock and according to anybody who knows anything about neurology. Excitotoxins are bad for the brain. They kill brain cells. So they made that illegal to put in baby food. So the blood-brain barrier is not developed in kids. It's obviously not developing in the fetus in mom. The blood-brain barrier can also be damaged during the birthing process itself. So even though it's not fully developed, maybe only partially developed in the newborn, during the delivery, if there's assistance, whether it's the doc helping pull the baby out with hands, forceps, vacuum, C-section birth, any upper cervical spine trauma, we know, if significant enough or forceful enough, can cause cerebellar damage, but can also tear up the portion of the blood-brain barrier physically that has already developed, which makes it more porous. So getting back to a little bit about the Tylenol and antibiotics. All of these studies, I'm going to put it in the scanner and include it in the document here. A lot of these are the review papers from Dan Murphy from some of the workshops I've been to from his, but also I am a, 6 or 7 year subscriber to his news review service. It's like $100, and he goes through probably at least 50 studies a year like this. So For the $100, it's well worth it. Now, this is from the Centers of Disease Control and looking at Tylenol in utero. What they were looking at is looking at moms taking it in pregnancy, because they're told, we know when they go in to their OB during their pregnancy, when they say, hey, I've got some pain in my lower back, I've got sciatica, I've got this fun stuff, they're told by their OB, don't take ibuprofen. Ibuprofen's bad for you, it's bad for the baby, which is sage advice. Also, don't go see a chiropractor, which is not sage advice. Here, take this Tylenol. And by the way, this is a study in 2014, and it says Tylenol does not help treat lower back pain. It is a study out of the journal The Lancet, right, which is the most prestigious journal in Europe, saying, hey, this doesn't work. We took 1,600 people with lower back pain. Now, this is not women who are pregnant, but we could, through deductive logic, obviously extrapolate that. And it says it doesn't work whatsoever. Well, that's interesting. They say, meaning the makers of Tylenol, well, this is a fascinating study. It's only one study and shouldn't change clinical behavior. Okay, that's 2014. One study should not change clinical behavior. 2015, what we see is a review of 13 trials finds little effect for best recognized as Tylenol acetaminophen. So you're right, dude. One study shouldn't change the 150-year history of Tylenol for lower back pain, but 13 studies reviewed in 2015 show the same effect, so maybe it should. So they take acetaminophen during their pregnancy. Now it's important because acetaminophen or Tylenol affects the liver. We all know that. It's the leading cause of liver failure in the United States. It kills 18,000 people a year, I believe. What people don't know is that it affects something called glutathione. Glutathione is the most powerful endogenous antioxidant that the body makes, by far the most powerful. Endogenous meaning it's made by the body, obviously. It knocks out that cascade pathway. That's important because glutathione, its primary role is an anti-inflammatory. It's also, neurocalming. We talked about the neurotoxicity and excitotoxins. It actually helps remove things like MSG, but it's also a very potent detoxifier of heavy metals, aluminum, mercury, and lead. Interesting, what they did is they looked at this study, Environmental Health 2013, they looked at circumcision rates and Tylenol usage in autism. Prior to the 1990s, circumcisions were done without analgesics, which in itself is crazy. But what they're doing is after that, kiddos, little boys, were given doses of Tylenol every 4 to 6 hours for 24 hours following the procedure of circumcision and 2 hours prior to it. So now we're loading these kids up with Tylenol at these early developmentally vulnerable initial days of life. Interestingly, male newborns, because of that, who choose circumcision, meaning their parents choose circumcision, receive 5 to 7 doses of acetaminophen, while their female counterparts do not. Interestingly, I think, consequently, males have 4 to 6 times higher rates of autism compared to females. Not the causative effect, but certainly contributing, I think. In the 8 countries analyzed in the study, acetaminophen consumption was correlated with autism prevalence. Right down here, acetaminophen, I'm just going to say Tylenol from now on, is suggested for pain management following vaccinations. In 1983, the average U.S. child received 8 shots before age 2. In 2011, it was 25, a 313% increase. And by the way, this is 5 years later, Dr. Dave. We're higher than 25 now, right? Acetaminophen treatment induces greater glutathione depletion. In all of these studies, Dave, which I'm sure you're familiar with most of them, glutathione depletion is a common factor with almost all of these kiddos who've been diagnosed with autism. Their glutathione production has been downregulated. Now, we will look back at this in a little bit because this number is actually much lower than it is because we're doing prophylactic treatment with Tylenol now before the kids get their shots. Look at this next study here, 2013 again. This one has 84 references. This is looking at the increases of autism, asthma, and attention deficit disorder coinciding with the replacement of aspirin by Tylenol in the 1980s. Because aspirin used to be used for kiddos that had fever, but then they said don't do that because it causes Reye's syndrome. So they replaced it with Tylenol. Well, when that happened, then we started seeing at least at the same time, the correlation between that and the huge incidence in the rises of asthma, attention deficit disorder, and autism. Interestingly, Dan Murphy claimed end of 2015 showed a study that aspirin use and Reye's syndrome in children, that has been debunked. It doesn't exist. So again, we're not just talking about autism and perfect storm kiddos and sensory stuff just with birth trauma. It has a profound effect. Obviously, we've seen it in clinical practice. We see that in a study with the blood-brain barrier damages. We see that in, Dr. Tony just mentioned, the osteopathic study, which I haven't a chance to look at, looking at birth trauma, and what 97 to 98% of those kids have upper cervical spine trauma. But it's not the only cause. You know, I call it total toxic load in that individual, which are the contributing factors in autism and spectrum disorders and ADHD and asthma. It's right here. Interesting, to me at least, Cuba has the same vaccination rates as the United States. However, they have virtually no autism. Interestingly, they don't allow the use of Tylenol in kiddos in their country. We look back at that study showing that there's 25 vaccines given compared to 8 30 years prior. So therefore, there's probably 3 times more Tylenol usage. I would argue that there's a lot more, because what's the trend now is the pediatricians are telling the parents that 5 days prior to vaccines, children should be taking some prophylactic Tylenol before the shots. So they may be getting 2, 3, 4, 5 doses of Tylenol during that vaccination process. It's not just Tylenol, Dave. Acetaminophen is in pain relievers, cold remedies, cough syrups, and sleeping aids, which, even though these have been found to be incredibly ineffective in kids, in fact, they're not even supposed to be used in kids, parents still give them to kids. This is remarkable. Again, we talked about aspirin being eliminated and then giving kids Tylenol. Boom, spike in autism, ADHD, asthma. When there was the Tylenol scare, when the crazy guy was putting cyanide in Tylenol capsules, people went away from it, and look what happened. Fall in autism rates during that time. Same thing happened in 86. Cyanide in the Tylenol, people stopped taking it. Bang, big drop in autism. Tylenol, long history of side effects. This is terrible. Administering Tylenol is likely to be much, much more toxic under fasting conditions, such as when a child has an illness that decreases the appetite. Well, now they're sick, they're not feeling well, and so what do? We give them Tylenol, and it makes it even worse. Vaccines with prophylactic acetaminophen are much more likely to suffer Tylenol toxicity. Again, getting back to it, glutathione is a very important antioxidant, participates in detoxification of certain drugs, etc., etc. Again, depletion of this diminishes the ability of the body to detoxify chemicals. Between 1980 and 2003, the prevalence of pediatric asthma in the United States throughout the world nearly doubled, and frequent use of Tylenol would deplete glutathione, increasing oxidative stress, which again increases neurotoxicity. It also looks at Russell Blaylock's work at excitotoxins, and it increases inflammation, which is it's bad. Depleting glutathione in the brain induces a neuroinflammatory response, and glutathione is involved in the removal of toxic levels